All right, excellent. So we are at 11, so I'm just going to get started. Welcome everyone to today's panel from research to impact, challenges and opportunities for using OR to solve real-world problems. This event is organized by the Women in Operations Research and Management Science, which is a forum at Informs. I am Chaitra Gopalappa. I will be co-moderating this session along with Dr. Ozlem Ergun. We are both VP of Meetings, and Dr. D. Yuen, who is our Vice President. Before we begin, I would like to acknowledge the work of many behind the scenes who made this event possible. Our president is Dr. Sarah Saberi, our communications team led by Dr. Oriana Calderon, and student liaison, PhD student Sanza Singh, and many others who assisted them. The agenda for today is as follows. I will first introduce the panel. Each panelist will provide a 5-minute overview of their current research using an example to highlight the successful transition of research to real-world implementation. We will then engage in panel discussion using questions that we have prepared. We will keep the last 15 minutes for Q&A from the audience. So audience, please feel free to type in your questions using the Q&A feature anytime during the discussion so that we can transition to those questions right after we finish our round of prepared questions. With that, I would like to introduce the panel. We have 3 distinguished panelists. They all have stellar records of research and academic success with many awards and recognitions. But in interest of time, I will keep their bios short and focused on the topic of today's discussion. Dr. Ozlem Ergun is a College of Engineering Distinguished Professor and Associate Chair for Graduate Studies in Mechanical and Industrial Engineering at Northeastern University. Her research work includes network design, management, and resiliency in critical systems, such as transportation, pharmaceuticals, and healthcare. She has worked with many organizations that respond to emergencies and humanitarian crises around the world, including USAID, many of the United Nations agencies, CDC, and other national and local organizations. She has served as a member on the National Academy's committees, such as on building adaptable and resilient supply chains after Hurricane Harvey, Irma, and Maria. Dr. Brian Denton is a Stephen M. Pollard Professor of Industrial and Operations Engineering at the University of Michigan, Ann Arbor. His research interests are in data-driven sequential decision-making and optimization under uncertainty with applications to healthcare delivery, public health, medicine, and schedule systems. He has a cross-appointment in the School of Medicine, and he's a member of the Cancer Center and the Institute for Healthcare Policy and Innovation at the University of Michigan. He also works closely with Internal Medicine and Department of Urology at Michigan and collaborates with the Mayo Clinic. Dr. Burcu Balcik is a professor in the Department of Industrial Engineering at Ozyegin University and is also the academic director of the University Sustainability Platform. Her research focuses on humanitarian supply chains and disaster management, where she develops data-driven analytical approaches to improve decision-making for better disaster preparedness and response. She has actively collaborated with many governmental and non-governmental organizations on various projects. She's also a member of the Science Academy of Turkey and serves on the Istanbul Metropolitan Municipality's Earthquake Science Council. Thank you to all the panelists and welcome to this panel. And thank you to all the audience. With that said, I will turn over I'll stop screen share, and I will ask each panelist to give us a 5-minute overview of their work, and then we'll follow up with a round of questions and discussions. I would ask Dr. Balcik to go first, if that's okay.
Okay, let me share my screen. Oh, you see also the next slide, or is it okay?
We see the first slide.
Oh, first slide. Okay. Okay, good then. Thank you. Thanks to Worms for organizing this webinar and inviting me first, and I appreciate the opportunity. And I would like to thank all participants for being there. What I will do first, as I have 5 minutes, but I should be quick. Briefly, what I do is, as Chatra mentioned, I do a lot of humanitarian supply chain work, but over the years that I started working in this area, I expanded to different areas. In general, I focus on crisis settings and develop analytical models to support decision-making in humanitarian aid, disaster management, healthcare, and food systems. So the common theme is there's a crisis, the resources are tight, and there are high stakes associated with demand satisfaction, etc. There are numerous challenges which lead to not always, but most of the time, interesting projects to advance the field. And as we are discussing today, how to translate these outputs, which could be solutions, algorithms, insights, decision support tools, to impact is an important question, like in many fields today. So there have been many studies recently that discuss this research impact, like the path from research to impact. And I think there are lots of different viewpoints and discussions, which is nice. The common theme is that I think so engaging with stakeholders is an essential step. Most of the time in the problem-solving process, most research is discussed to be covering only steps from 2 to 4. Covering all steps has its own challenges. I believe, in my experience, covering one is reasonable. If you do work on this topic, humanitarian logistics, it's not that difficult if you have the partners. But 5 and 6 are always on the challenging side. And I think in order to implement and evaluate the solutions, you need dedicated resources and commitment from the organization you are working with, and it is another process. But if you are only covering 1 to 4, in my experience, it's still like possible to contribute to implementation by developing solutions, policies, practical insights. Sometimes you don't have the people to implement these, but still you can make a change by enabling organizations to have these informed conversations with the authorities who would make the change eventually. And some of my research, which I will give an example today, like aims to do this advocacy for them to derive positive change. So I will give 2 examples, maybe 1, given the time limits. So both started about 7 years ago. Let me say it's a long process, but they are still ongoing. Our relationships have evolved over time with these collaborators. The first one is by ESOOPS. Actually, this research has started in an academic conference over the tea break or something. So we were just discussing. I learned that there's this branding process which organizations had to put stickers on these relief items before the disaster. It comes sometime from the supplier like this. And it ignited me like, there's the product differentiation postponed. What if the branding could be postponed? So that discussion turned into this study, which started as advocacy purposes. Like we just wanted to show when or is there enough performance improvement in demand fill rate or response time, in like the costs, if this postponement takes place. So I won't go over the research part, but over time with this organization, so we did reports together. So we published research outputs in executive summaries. I presented several times in practitioner conferences. And recently I saw some comments in the last HMPW practitioner conferences, comments that some organizations, based on these findings of this research, that postponement really works and helps with different KPIs, they started doing that, maybe a small step, but so it is an example that how research, I mean, implementation could not maybe sometimes like having the decision support tool and really implement it as a software, but showing the benefits of a new system could be possible. So the other one, maybe over time, I would mention that, but it is related to serving these chronic patients after disasters. I just want to show this, that it is a very long process. It just started with me reading about Hurricane Maria in 2017, and over time I reached to like practitioners. I learned a lot from them. So something that I will mention maybe in Q&A session, that making like dashboards, visualizations along with your research products would helps the conversations with these organizations. And in the end, so besides the research output, like many students are working on different papers. So we were invited to do, it was a very honoring event for us, that National Nephrology Congress as a plenary to to explain the outputs of our findings related to how to serve these patients in crisis settings. So also impact, I mean, these are not measurable things, but I had to do a lot of, unfortunately, due to the earthquakes in Turkey 2.5 years ago, I was engaged with lots of stakeholders and public in different occasions. Maybe as a last word, I would say that maybe media, how to appear in media, how to explain what we do in different outlets could be something to discuss in the future. That's about it. I hope I didn't exceed my time a lot. Thank you.
Excellent. Thank you, Dr. Balcik. Dr. Denton?
Thanks. Let me just pull up my presentation here. While I'm doing that, thank you very much for the invitation. I'm delighted to be here with such an amazing group of people. And let's see if I can get this going. Okay, can you see all that? Yep, great. So yeah, I love the topic of this panel. I've enjoyed projects where I've had the opportunity to implement research, probably the most among the work that I've done. And I thought I would start just with a story about a single project. And this is a project that involved looking at imaging for early detection of metastatic cancer in patients that are diagnosed with prostate cancer. Started in 2013, very serendipitous. I met some collaborators that had organized a statewide collaborative called MUSIC. That's the Michigan Urological Surgery Improvement Collaborative. Basically, they had an extraordinary data set for men diagnosed with prostate cancer across the state. And they wanted to tackle a lot of problems. And the first one was to try to reduce unnecessary imaging of patients that are diagnosed with prostate cancer. This was believed nationally to be a significant concern. And there was a big opportunity here. And so when I say imaging, I'm talking about bone scan and CT imaging. This happens after somebody gets diagnosed with prostate cancer. And the question is whether they should get imaging to try to detect whether cancer has spread to become metastatic, because that changes the treatment options. If it's not metastatic, curative treatment is an option like surgery. If it is, then there would be no benefit to that. And chemotherapy and other systemic approaches are what's appropriate. So basically we're looking at how you could use risk factors for metastatic cancer. And these include things like age and race and ethnicity and biomarkers, pathology data that comes from a pathologist's review of samples from a biopsy, clinical tumor stage, and some other things. And the idea was to create something that could help physicians decide whether or not to recommend patients for imaging on the basis of models that predict the outcome in advance for a CTMH or bone scan imaging study. So that was the gist of it. I wasn't so sure about this project. If I was pre-tenure, I may not have even engaged in it. It was completely focused on impact, with the idea that publications would follow from this. Kinds of methods that were used: statistics, simulation, machine learning, optimization. I had some familiarity with most of those, very little with machine learning. This was an opportunity to learn a lot more about these things, and this project really transformed the way I think about how to use data. So there's a huge problem with bias. We had data on patients who were imaged and not data on patients who weren't imaged. So it's a semi-supervised situation, and patients who get imaging are a naturally higher risk group. So if you only use that data, you get results that really don't make any sense, incredibly biased. And so that changed the whole way I look at using data for research. I used to think bias was a second order effect. And so this led to looking at lots of different approaches. I learned a lot from it. My students learned a lot from it. We developed initially some standard predictive models, like logistic regression models, and then more advanced machine learning models to see if we could push things to be even better. And then some simple and interpretable guidelines that were close to optimal, but weighed the need for simplicity and interpretable guidelines. And I'll let you guess which one actually got implemented. We had different kinds of implementations, like implementation on an iPhone, a website, and then I should have put this on the slides. It's literally a card, like a hard copy card. I don't know how well you can see it, with the simplest possible guideline that achieves almost all the benefits. What we did was, so moving ahead, long story short, we, in around 2017, were in a position to evaluate the effects of implementing this approach. And I don't always do this, but I was very happy when it worked out, and also nervous about whether it, how things would look. But what we found was you could get imaging, bone scan and CT scan rates down very substantially. And the big important consideration with that is, and the fact was that there was no statistically significant decrease in detection rate. So you could think of it as removing unnecessary imaging. There's so many other great outcomes. There's a paper that culminated from this in operations research, lots of other papers in more medical journals, and some more journals that could be sourced back to this. Some NSF funding and multiple NIH grants that came from it. Some PhD dissertations, and a lot of undergrad and master's projects. And Celine Merdin and Christine Barnett were the driving force behind winning the Inform's Doing Good with Good Oral Prize. So I was just closing up. I'd say, like, necessary conditions for success, something like this, was active and enthusiastic industry collaboration with collaborators who can instigate change. And a very important problem that needs to be solved. Urgency is the ideal situation. A very open mind about how to solve the problem, and a bias towards understandability and ease of implementation over accuracy. So not letting the perfect be the enemy of the good. So I'll stop there, and thanks for your attention.
Well, thank you. Dr. Ergun?
Yes, and let me find my, okay, I think this is it. Oh. No. Wait, where did my, okay, here we go. All right. Hi, everyone. Thank you for the invitation. And kind of going last also means like I don't have too much else to say after Burcu and Brian, but I'll try. So I was, before joining you guys on the panel, I mean, to the audience, I was telling them like I'm probably the oldest one here on the panel. So I've had almost 2 decades of experience trying to do both good operations research work, but also how on the other side also have impact in the real world. And really, I mean, maybe even not going through so much of my slides, but I just want to say that this happens to everyone in different ways. There is really no one set cast of you do this and then this and this, like, and then you have impact. I have seen many different ways of it happening. I'll try to give you some examples, and I try to choose 2 examples that had like different characteristics, actually, and some commonalities, but some differences, so that it might be demonstrative. So for me, it was kind of interesting reading the panel description that was sent by Worms. So the theme was kind of how do you go from translational research to impact? And I must say, for me, it's exactly the opposite. So I'm actually, I am in my training, in my PhD training, I was a combinatorial optimization geek. I'm a network combinatorial optimization person. I got out of my PhD. I was like, really, I loved the numbers and the graphs and things like that. So I do get a kick out of doing a lot of kind of methodological work. On the other hand, I am also interested in societal problems, and I do want to have an impact. So how did it all work for me? I think I do my like methodological work. I'm interested in it. But then whenever a problem kind of presents itself, or sometimes I go after real world problems, I just go for the interesting problem or the high impact problem. And then I try to understand what is there. Is there something we can help with? Is it just a consulting project, right? Or is it like, is there something in it that actually will require PhDs working on it, right? And I mean, sometimes I like to do the consulting projects too, because of its impact, but I'm also always looking for problems that even if the societal impact is, or the real world impact is not going to include this kind of translational research, but then I can go from there, I get inspired by the real world problem with my students and my lab and my partners, and then we can do some translational research because we learn something about the real world problem that's just so far not been explored in academic research. So for me, it's kind of like really going, while I also do my methodological work, my impact work usually starts from the problem, and then it helps me to actually build translational research later on. So it happens differently for different people. So for me, I'm just going to go over 2 examples, but in very little detail. So don't worry, I won't take all the time. So I think my biggest implementation to date is still the United Nations World Food Programme supply chain optimization work. I have been working with them for over a decade and a half now. The biggest thing we did was to take bunch of different supply chain functions, such as the programming, the modality decisions, the procurement, and then logistics and routing decisions, and then putting them all together in one optimization decision-making tool and actually getting it implemented. So, you know, this sounds all great. It took me over 10 years to actually get it done. And it's not me, it's like a huge team. There are academicians in Europe. There was, when I first started working with WFP, there was 0 operations research or industrial engineers in the organization. Throughout the project, now they have a huge operations research team there. So it's been this whole engagement so this is kind of the timeline starting at the 2000s. It's 2025 now. I still work with them in projects here and there, but it takes a long time, right? And this project has gone through a lot of different phases where, like, in certain phases, I and my students had a lot of involvement. In certain phases, we took a step back because they were doing like a data implementation and it wasn't really our thing. And then we came back when it's like right now we're talking about like some really hard stochastic optimization problems with them, because now they're ready to really go into very hard computational problems as well, right? So it takes different ways. I would say the one thing that I think is common in all these projects, and I think both Burcu and Brian mentioned this, is that you need to have commitment and time allocated from the organization also in the project. If the organization doesn't have any commitment and they're just telling you like, just go and solve this problem for us, it has never worked for us. You know, it has never worked for me that project at the end gets implemented. So the other one that I want to talk about, the other project, and I just chose this in comparison to WFP work, is because WFP decades-long work, right? This one during COVID-19, engagement happened over like an hour. I got a call in my house on a Sunday from the Secretary of Elderly Affairs in Massachusetts. And she said, like, can you help us logistically to move a bunch of their basically clients in their elderly facilities, including nursing homes and others, to other places? Because first they were thinking about like really separating their the patients basically or the beneficiaries into COVID positive and non-COVID positive facilities. Of course, like within 2 days, they learned that's just not going to happen. And then our project completely got changed and it became, can we actually create as a platform, a digital platform where we can match medical staff to nursing facilities that needed staff immediately. So this was like, compared to the WFP project, this was like bam, 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 like getting a call, like, can you do this? Okay, we'll try to help you. Me calling my students, like, we need to get like really mobilized and do this. And then 2 days later, the project changed. We created a platform and started working with the Secretary of Elderly Affairs team within days. And then the platform was running in 10 days. And then we ran it for a year and a half. And in the beginning, we were running it night and like twice a day. Then it kind of became once a day, every day. And then it just kind of like, it became like twice a week, once a week, blah, blah. And then it kind of fizzled down. But very different application, right? But then we were working very closely with people on the client side. And we were really helping with an immediate need. So very different. I think it had a lot of impact. Here's like, I mean, I'm not going to go through this. This was kind of what we did. Oops, sorry. And here's like some of the impact. But what I want to say is, like, actually, if you look at this is kind of like a consulting project. It wasn't really that hard to do this, right, from a PhD kind of a point of view. However, we were able to like do it very fast. We didn't we really helped quickly. And then this ended up really resulting in 2 PhD theses, or like parts of 2 PhD theses, because as we learned the process, as we experienced different aspects. So for example, getting feedback from the facilities and the medical staff was impossible, almost like trying to see, like, we sent you matches, but did you hire these people, right? So we started really thinking about how do you do this? Like, what is the engagement? And so what was the real impact? And kind of like, as Brian is saying, like, then I started collaborating with another faculty member in marketing in the business school, like trying to kind of like answer some of these questions that I really don't know that well. Like, I've never really thought about that well. And then one of my students ended up really working on these like dynamic matching problems that like, you know, both-sided dynamic matching problems, and kind of thinking about, you know, the things that we just didn't have time to think about during the implementation, but it existed as characteristics of that situation, and it was really not studied in the literature. So that's kind of like, I just want to show you two examples, but I'll leave it here and then we'll answer questions. Thank you.
Excellent. Thank you so much to all the panelists for discussing your work. We have some questions that we had prepared in advance, and you've touched upon several of the points in these questions, but I think it'll be good to discuss each of these separately. So I'm going to start off with the first question. How do you plan implementation work? What are the factors you consider, and at what stages of the research work? So it does seem like, you know, given your experience, you've all had several years of experience and you've had strong stakeholder engagement that each of you mentioned as extremely important. But, you know, for someone who is getting into this area, or, you know, trying to translate their research, so for early career stage researchers, you know, what would you suggest? You know, how do we go about planning for a project that we can ensure successfully translates into implementation and has an impact?
I'm happy to say a couple words about that. And, you know, I don't wake up in the morning and imagine a project and think, okay, I want to do this and implement it. Like, it's much more like a random walk, sort of. I talk to a lot of people in areas that I'm interested in, and then serendipity plays a big role, you know, identifying, like, somebody contacts me and says, it seems like what you do could really help fill a gap in something I'm trying to do. And so when it comes to things, you know, involving research that could lead to practical impact, you know, I'm more involved in the, you know, the pieces that I understand and communicating the ideas to other members of the team. So I wouldn't consider myself an entrepreneur. I'm more like a collaborator that helps with achieving goals. You also mentioned, like, junior faculty, and the project I talked about, I don't know that I would have done it when I, like, pre-tenure. It resulted in a number of publications to medical journals, which I'm personally very excited about, but not all promotion and tenure committees are excited about that. And so that at some places may not really count for much. So it's something to be aware of, because a lot of things are out of your control, and how fast things can move is dictated by what's possible by all the, you know, stakeholders in a project. So that's been my experience, but I'm sure others have had, you know, different experiences to contribute.
Yeah, I mean, I would say I kind of, you know, echo or double everything Brian said. I think it's definitely true for me too. And again, I do say in the implementation work, it's hard to, I mean, of course you have a research plan or you have a project plan, but you are ultimately working with a bunch of different people and different and potentially interdisciplinary groups of people as well, depending on the area. And your biggest impact could be, you know, or your biggest academic impact could be actually in different fields. And this might actually get published in different journals. And I think you need to be okay with that if you're doing this kind of work. I would say as a junior faculty, again, like Brian, be careful. And always, like, I think my saving point was always like, I'm doing this work that's really interesting and it's going to have impact, but then I'm kind of, like understanding salient operational futures that's going on that can be then like really distilled into like an operations industrial engineering type of research that's interesting for those groups too, but it takes time. And I would really say like planning is hard. I mean, you do plan, but it's like, it is a different kind of an experience than doing an NSF project where you kind of like sat down, you conceived it, you have a plan, you have your students, you kind of, you do that too. Like I would never like really advise anyone to give up that part to do impact. I mean, I think you really need to do that part as well. But be open-minded, create the really think about how you're going to create the operations research industrial part of research as well as you're doing these things.
I don't think I can add more to that, but I can also say that planning is difficult, especially at the beginning stages, if it's a new organization or a topic that you have not explored before. And it depends on your resources and the team that you have currently, or maybe you have students, but they all have projects, and or you already have a lot of projects. Then, I mean, when you have time or not. And when there is an engaged contact person in the organization, and if they know what they want initially, and there's a team there, like Ozlem mentioned, like World Food Program has already a group of people who will be doing maybe that work, but you give your expertise, and collaboration could be more efficient maybe. So usually in my cases, it's not like that, because you start a dialogue, you try to understand what is going on, whether there is something interesting there. So it takes time, but sometimes getting out is also a good strategy after a few meetings. You don't need to promise things, especially if it is pro bono. And also maybe collaborations. If you want to do this, but you are not sure how, and you are a junior researcher, you can try to join the research labs who are doing those things, and you can be a member of a team, a couple of projects. You can offer your, again, expertise, be a part of the team, and then it won't take much time, and you learn along the process how to talk with organizations. And I think it would be a good strategy in early years.
And thank you. And so it does seem like doing this kind of research during your early career stage is probably something that we need to really think about before getting in that direction. And at the same time, as you're moving up the career, it does seem like you've built these stakeholder engagements, and it does seem like it takes some time and trust to connect with these organizations. So I'm just wondering, like, when and how do you make that transition? So thinking about the academic way of evaluating things, and then later on, sort of moving into this translational stage of the research. How do you make that connection? What would one need to think about in order to move in the direction?
So, Chandra, can I just ask a simplification question? Like, moving in direction of what? Tell me again, please.
Right. So you all mentioned that you wouldn't have taken up this work early in your career, but later on in your career you did sort of engage with these organizations, And to me, it seems like engaging with these organizations and being able to work with them does involve some kind of trust with the organization, which in itself takes a long time. So, so how do you go about making those initial connections, given, this is something that you wouldn't recommend for early career stage researchers. So, like, how do you make the transition over time, I guess, if that makes sense?
Okay. So I would say, first of all, I didn't mean to say like you shouldn't do it early on. Like I think you should, is just if you want to. I mean, it's a different way of life. But what I think what we're trying to collectively say is like you should be more careful about it, and you should definitely, I mean, at least from my point of view, you should definitely have other things going on to other plans. Like I think the academic career works best, even if you want to do applied research, if you have kind of a synergistic kind of methods, fundamentals, kind of research and ideas on one side that is synergistic with what you want to do on the others, like on the applied side as well. Like that's my advice. I'm not saying that you shouldn't do it. It's just that you should be maybe more mindful of exactly what you're doing and where you're spending your time, and how are you going to translate some of this applied work into something that can actually be on the fundamental side for the academic research as well. I mean, I would say engagement takes time, but I mean, you should do it. Like if you want to do applied work, for me, the way it worked was like really actually going and knocking on the doors early on organizations that I thought was doing interesting work that could use the type of tools that we're bringing in as PhDs and academicians. Again, as I said, like not like kind of the consulting work, but just really like, you're really solving hard problems. And here's like techniques that we can implement, right? We can actually see. And it takes a lot of tries. I mean, this is just kind of like also writing proposals, right? You don't do one and expect it to hit. It's the same as like you do 10 and you expect 1 to 2 to hit. So it takes times, but it also writing proposal takes times too, right? It just, you try and you have a certain hit rate. So you always kind of take the expected value, kind of do the backward calculation, how many tries you need to do. And I would also say that, like kind of, I think your question was like, how do you choose the organizations? I think I choose, I mean, based on what they do, what's their core business. Like my academic work is in transportation and logistics, and the World Food Program is the humanitarian organization that has the largest logistics service in the entire world. So like it was a natural place for me to go and talk to, right? So you kind of figure out like what you do fits with this organization really well, right? So, and I was the first one to go and like knock on their doors, and then it kind of worked out.
I agree with everything Ozlem said, and the being careful comment might be sourced back to the comment I made about that specific project. It turned out that that this was something that it led to many things that were impactful academically, like publications in OR and engineering journals, grant funding from NSF, but also from NIH. I mean, in retrospect, it was perfect, but it did require me to learn a lot of new things. And that's something I like to do. I like stochastic optimization the most, but this was not a problem where I could take that hammer and try to hit the nail with it. It required, a lot of learning, which I enjoy. But it did take time to see the benefits from operations research perspective. But they're like, and I'm saying all this sitting in an engineering school where, of course we apply science to socially important problems. So it might be different in other, other fields, for instance. So I make no claims beyond engineering.
And I want to add something that I recently had an experience with a project. So I was sitting in a meeting for an event where FAO had come, Food and Agricultural Organization, had visited our university for the World Food Day, and there were different researchers in the same table. And then I learned from colleagues sitting in the right by me that they are working on a project about assessment of the earthquake affected area. They are social scientists, and they will be visiting 2,000 villages in a limited time with a limited budget, and they will be doing field surveys. And I said, oh, I have done a project 10 years ago on needs assessment planning, and this could be the same structure. We do sampling and routing, planning, let's work together. And we have been working now together for 1 year, and we gave them the logistical plans for the huge area that they need to visit. A master's student is now working on a thesis on that. Sometimes it is not that you have to spend a lot of time and effort to have a radar that where you can contribute. So different disciplines in the university also you can contribute to that. There are always decision-making problems in many, like the COVID, for example, was a time where everybody was working on some side of vaccine development, distribution, logistics. Those opportunities are there. It's not supposed to be a very big task that you have a separate project for you that you have to allocate a lot of resources and time.
Can I just jump on what Burcu said? Because I think that really also resonates with me, that like exactly, like you can just see things that are around you, right? Like I think starting with local organizations, local problems, I think is a really good idea, or like just kind of keeping your radar open to problems. But I think, yeah, I mean, there are also a lot of things that are going on, I think, in everyone's locality that you can look at and start to see, like applying the systems perspective even, right? I mean, just to help. Doesn't have to be the biggest thing, right?
Excellent. So what I'm hearing is just go for it, network, talk to people. Those are excellent points. For the audience, please do submit questions if you have any in the Q&A, and Dr. Ergun will moderate that. Aram, do we have any questions? If not, I could continue with some of the questions that we have.
We don't have any questions, so we can continue.
All right, sounds
But
good.
I do see a lot of questions in the Q&A, 36 questions, mostly from one individual.
Yes.
We probably want to spread it around a little bit.
Yeah.
But
So we
yeah,
that
probably
person.
keep that out for now.
yeah.
We
All
will.
right, thank you.
We have curious person, very curious one, yes.
Sounds good. So, I think, a couple of you touched on this a little. So, what are the common barriers that often prevent technically sound research findings from being adopted in real world applications, and how do you navigate these?
Sorry, could you repeat that one more time, Chaitra? I'm sorry.
Sure. So what are the common barriers that often prevent technically sound research findings from being adopted in real world applications? And I'm sort of, broadly thinking about this. So you mentioned that you tried out different modalities, and the simplest one was the one that, was more implementable. So I was just, curious to know, like, how do you navigate identifying how you go from looking at complex problems, which does need a complex approach in certain ways, but at the same time, to make it implementable, it should be simple enough that it is we can translate it into real world applications. So I was just, curious to know, how do you go about navigating those technical domains and translating it into implementable solutions? So this could be related to communication of complex research outcomes in a way that it is understandable to everyone, and other challenges.
Thanks a lot. Yeah, I'm happy to chime in with one barrier. I mean, I think there are a lot. One is you're never going to be a subject matter expert on everything to do with a project that's aiming to implement something, right? Like, I'm not a urologist, and they're not an operations researcher. I'm not a biostatistician. I'm not a patient, thankfully, but these are all people that were part of a team that provided feedback, and so there's a learning process. I think of it as like mini lectures. Okay, I'll explain something about this notion of a mathematical model and optimization, and they'll explain, to me, how some of the disease dynamics work and what the critical factors are, and if you like that sort of thing, like I love that sort of thing, then it can be really rewarding. But you have to be open-minded and want to understand things. I'll never understand things at the level that a urologist does, for instance, but that's not necessary. It's a very team-focused project, and so we need to understand enough to be able to communicate with each other. And I would say that, so there's a fixed cost to getting going, but then once you have that, you have potentially collaborators for the rest of your career. I mean, I've been collaborating with the same group for more than a decade, and it's led to all kinds of other projects, but there was a bit of a fixed cost of getting started.
So I would say for me, and I think it's a slightly different barriers, because probably also the type of work we do is different with Brian. Like, I usually work with on supply chain and logistics and transportation type of applications. And usually the success only happens if the organization is willing to also at the end hire and build people and build a team that has some kind of an operations background. So because the output of what we do is usually some kind of a decision support tool. And at the end of the day, these are decision support tools for quite complex problems with complex data structures and so on and so forth. And I think the biggest thing is to kind of convince the organization that it would be worthwhile for them to hire people with this kind of background who can actually operate and maintain these kind of tools. I think it has almost never worked for me that, like, oh, I have a black box tool here, here's the organization, and they have no background, like they have no one who has a background in this, right? Who can, and then the dream is like, you have the black box, and then from now on to eternity, you can run this with no understanding of operations and industrial engineering concepts. So to me, in the type of work I do, it's very hard to have like this kind of long-term impact in an organization if they don't agree to actually put some institutional resources into these kind of building the human resources capital also. I mean, I do think it's the nature of the type of problems I solve that is hard.
I agree, and I have an experience about that with eSoups, this branding, postponement of the branding project we did. We also have another project with them. They have a platform called Stockholm Platform. Their objective is to improve coordination and collaboration in the humanitarian sector by just making prepositioned stocks visible so that everybody sees each other's stocks, the organizations. So we have another project with them. For example, they requested our codes to incorporate to their platform like a simple optimization model that shows whose stocks should be moved when a cyclone will be hitting. For example, it is the case studies for Madagascar with HEC Montreal. The partners, my collaborators are there. So it's been 3 years, I guess. We are developing the models and codes and everything. Now we are at this stage where they have the team within that platform. So we are delivering our codes and we are supporting them with the integration and everything. So that will happen like that. Otherwise, you cannot just deliver your codes to an organization and they will implement it. So it requires another process. With COVID vaccine allocation project, we had a funded project with Norwegian Research Council. We did all these meetings, stakeholder meetings with public authorities, and we developed a tool. We tested with them, so we got their feedback and everything. It was online. It was being used, and the time was up for the software licenses and everything. But it is there. I mean, it could be. I mean, I hope not. But if something happens again, that tool is there, could be activated and used, tested, got feedback, etc. But there was another group working on that tool, not the operations research, the model, and the algorithm designers. So there should be different groups who are doing that, and there should be a commitment to implement it, as Ozlem and Brian suggested.
Chaitra, there is a question from the audience that I wanted to ask our panelists. I'm starting as an assistant professor this fall. What is one piece of advice you would give your first year pre-tenure self if you could go back? Thanks for the lovely webinar.
Yeah, I mean, I'm happy to throw something out. I think advice that I think I followed to some degree, and this contradicts what I said earlier. But you know, you need to take some risks. Like you need to develop. If you're in a position that has a significant weighting on research, then you need to become independent of your advisor. Start something that you are leading, at least from the operations research, or management science perspective, or whatever you like to call it. And so if you don't take any risks, I think that then you're at risk of not achieving that, right? And that's fundamentally necessary. So, I actually, thinking about it, I think I probably would have been excited about this project if it came right at the beginning of my starting a academic career. But like, if it was 4 years in, I think suddenly changing directions and trying to learn about a new subfield is, I mean, it's something I would have wanted to do, but tenure makes it hard to do that. It's one of the downsides of academic systems, I think. But investing a little bit, because there's life past tenure, and that gives you a freedom to do many things. You can't start them immediately if you don't get them started early. So I think there's a balance that could be achieved there. I hope that helps.
So I would give 2 pieces of advice, I think. So one is, I would say, do the things you like. Don't ever do things that you don't like to do. It's not worth it, and you'll probably end up not being good at it. I think you should do things that excites you, intellectually and spiritually, I would say. And then I think the second one is grow a thick skin. I think in academic life, it's a lot of writing and proposing and talking about your ideas, and then you get rejected. I think all of us get rejected all the time, in proposals, in papers, and this and that. But you should never, I would say, take it as a sign of like complete rejection. Just grow from it, like take it, understand the reasons, and then iterate on it with the advice you got, right? Like, I mean, don't iterate on it by just like sending the same thing just to another place, but like learn from it and then get to the next iteration.
Okay, if I may add to that, I think finding people you like working with is very critical if you can. Maybe more than the topics, maybe like people you collaborate are important over time. And if you already have good mentors, don't let them go. Keep connection as they may be busy, but I think that's important. And at any stage, mentors are important. And just keeping connections growing helped me a lot. Like I'm based in Turkey, but I don't feel, for example, that I am isolated somewhere in the world. Like just being connected to organizations, researchers, communities, this is helpful in general to keep you alive and energized and find the things that you want to do. And that would be my advice. Congratulations, by the way. Thank you.
Excellent. That was an excellent question and an excellent points, an excellent way to end this panel. Thank you all so much for your great insights in this work. And thank you to all the audience for joining. I would like to leave you with one more information for those of you who would like to know more about worms and join this forum. I just put a link in chat for how you can go to the website and join to become a member. We will have one more webinar for this summer, so please stay tuned to hear more about that. And with that, I thank everyone once again and have a good rest of your day. Thank you.
Thank you all.
Thank you.
Thanks,
Thank
Chaitra and
you.
everyone involved.
Thank you, everyone.
Thank you.
Thank you very much.